Okay, thank you everyone for taking time to participate with us again in another town hall meeting. It is a beautiful sunshiny day in Gothenburg, and it is starting to feel like April finally. We're very excited for that. So thanks in advance to all of our panelists for taking time to present with us today. We're going to jump right into it with the same question and answer format that we utilized last week. If anybody during the presentation has a question, please email that to deb@gothenburgdelivers.com. Again, please feel free to email questions to deb@gothenburgdelivers.com. With that, we'll jump right into the questions that have been submitted already. So would like to welcome Katie Mulligan from Two Rivers. Thank you for taking time to be with us today. The first question for you today: is it true that the growth rate of positive tests in Dawson County has been among the fastest growing in the nation recently?
That is true. We're looking at a pretty extreme jumps daily. I'm just working on the numbers for Dawson County right now, and it's going to be well over 200 by the end of today. 200 cases in the county total. And we are, partly that's due to the extreme amount of testing in the area, but it's also partly due to the extreme amount of coronavirus in the area as well.
Great, thank you. I've heard or seen in the news that the National Guard was dispatched in Lexington. Can you share with us a little bit about that?
Yep, so we provided National Guard, we worked with the National Guard, the Nebraska Public Health Lab, and the Department of Nebraska Health and Human Services to provide to date about 440 or so tests to Lexington, but with availability for some of those other communities to be tested for on-site in Lexington. It's actually really cool. I have a picture from it of the National Guard pushing cars through a facility. Well, they just reach into your car and swab your nose and off you go. And then we call you later with your results. We're looking to probably provide more tests in the future, and we've been hopefully getting more tests in Dawson County overall.
Great. So were the tests administered, out in a parking lot somewhere? Yeah, that's fascinating
Isn't that
love
fun?
to see that picture. Yeah.
Yeah, I'll email it to you, Nathan. It's it was a drive-through. It's like a city garage type facility that they're using, and they you drive through one end, the guard stops you and asks you questions, has you fill out some information, and then they it's a nasal pharyngeal swab, and I can let our doctors on the call maybe describe those a little better, but essentially it's a Q-tip they shove up your nose. They kind of try to get back there in your oral cavity and get a good sample, and then they kind of send you on your way.
And how were the people that were candidates to be tested determined?
We had help from some providers to identify individuals and send them, and then it ended up being a first come, first served testing facility. I know that the facility, and I'm sure there's people that can attest to it, they were overwhelmed with people willing to come get tested, and we definitely, everybody that showed up to be tested was not tested.
Okay, well, good. Yeah, thank you for the insights there. As it seems like there's been a big response to that instance in Lexington. How are our resources holding up in the area? Medical resources, tests?
Right. We're working through it. I know the hospitals are working with clinics and with emergency responders and long-term care facilities. We're trying to inundate all of the facilities with personal protective equipment. We did provide quite a bit of equipment to hospitals Monday, and then to some other places again starting Wednesday and yesterday. Yeah, yesterday was Wednesday. I know what day it is this week. Starting yesterday and then again today, we're still sharing equipment, and we're still accepting requests for more equipment to get as much PPE as needed.
Katie, I think part of the reason why it's tough to remember what day it is because of you and many of our medical community Saturdays and Sundays don't really exist. Those days off that had been previously scheduled, they're off the calendar. So every day's a work day. So it is easy to lose track of that. Good. Another question about if somebody is identified as having COVID, the resources to treat those people, not only test the people, but treat those people. How's our resources holding up there?
Some of those resources, like we know thermometers, when I go to the grocery store, every time I see all of that cold medicine is gone. There's not a really specific treatment because it's a virus, so it's all treatment for symptoms. So stuff like Tylenol, Advil, cough medicine, those things are what's being used to treat it. And those are all in short supply for what I know. And not having been in Walmart or wherever in the Dawson community, I don't have specific knowledge, but I would assume we're pretty low all around on those supportive care methods.
Great. Thank you for that insight. When it comes to the test itself, can you tell us a little bit more about, you described how the test was administered, and it's hard to imagine people getting lined up to have a Q-tip pushed all the way to the back of their head. That doesn't sound like very much fun. But what's the turnaround time from when you're tested to when you can have results?
It's about 2 days. Given the amount of test results we're receiving back, where it's probably 2 days for the lab to process it, and then about 2 days for us to process it. So about 4 days, usually less than a week, but it has been longer in some cases.
Yep, good. Thank you. Well, appreciate your input and all your hard work, Katie. Thanks to the whole Two Rivers District for all the work they're doing on all of our behalf. So thank you for that. With that, gonna have some questions for Dr. Dalrymple. So Dr. Dalrymple, thank you for taking time to be with us this afternoon. Wondering about masks that I see. There's a lot of different types of masks. Last week, you gave us an example on how to properly put on a mask. Can you give us maybe the differences between a cotton mask and different things like that? I think it's a fascinating topic.
Okay. Yeah, so thanks, Nate. So first of all, if you hear any other noises, you'll have to forgive me. I'm got my son with me today down in Omaha. We're doing some testing at children. So please forgive me for that. And so for masks, so I do have some mask examples. Again, these are more, the ear loop masks that we use in the hospital for procedures and things like that. I think the question that's coming up is what exactly is protective about masks and why are we wearing them? And I think that's always good to go over. So the premise for wearing masks out in public is really kind of contingent upon everybody doing it. So it really is to protect others from you if you are an asymptomatic carrier, or if you are sick and you cough in the mask, that mask will hold those cough droplets and sneeze droplets and minimize that spread to others. And so you wearing a mask is helping protect other people. And in a healthcare facility or in like a long-term care facility, it's also, it's to protect other patients as well as the staff in that sense. So we're wearing the masks to protect patients. And, then we have like the respirator masks, the N95 masks, and that filters quite a bit more. And that's more protective for us from other people. So I hope that makes sense, but that's kind of why we're wearing them and the different types.
And that's something interesting that I really haven't thought about a whole lot. There's probably people that have COVID, but that may not know it yet. They may not be developing symptoms or displaying symptoms, and they may not develop symptoms. And so when you use the word asymptomatic carriers, what that means is sick people that are carrying it, but appear to be healthy otherwise.
Yeah, I can't remember the last time I saw the numbers on that, but they are questioning that number was high. I don't want to quote a number, but I feel like it was reaching towards maybe 15 to 25%. So if anyone knows that number for sure, please share it. But it's a higher number than we initially thought, and I think that's part of where the recommendations for wearing masks in public comes from.
Yeah, and in some ways that could be construed as maybe even good news as it pertains to the virus. I know in my mind, I think about somebody who gets a positive test and all the negative connotations that could come with that. But if I'm understanding it correctly, there could be people that have experienced COVID but have handled it very, very gracefully. Is that
Yes,
accurate?
yep, absolutely, yep,
Great.
absolutely.
That helps to give me hope. So appreciate you sharing that.
Yeah.
Had a question submitted about people who smoke. Do you think they would have more critical symptoms than non-smokers?
So anyone who smokes, by definition, that is pretty toxic to the lungs. So it causes chronic inflammation, and it really puts you at risk for just not having healthy lungs. So the short answer is yes, I think so. There's, I did a quick search on that specific topic and couldn't find a whole lot in the medical literature yet. It probably just hasn't been really put out there. But, one of the known risk factors for more severe disease with coronavirus is chronic lung disease. And I'd argue most people, if they are chronic smokers, they have some form of chronic lung disease. So the short answer is yes.
Yep, absolutely. Thank you. This question has maybe been asked, but it's been resubmitted. There's like Vacation Bible School potentially planned for this summer. I know places are really wanting to engage and get back to normal. Any of those large group gatherings, any advice from a medical perspective if you're tasked with planning one of those events?
Yeah, I think I wish I had a more definitive answer or a better answer. I think right now it's probably prudent to not make plans for the summer. I mean, it's already almost May, and we're starting to see large numbers in our area right now. So I don't suspect that by June 1st there's going to be a massive change that allows us to get into large groups and gatherings again. I hope that in the preparation for that we can all work on maybe doing it in a different way and get creative. But I would say I wouldn't make a whole lot of plans right now for the summer. I don't want to be the Debbie Downer, but I think that's probably where we're at right now.
But I think that's very important for all of us to manage our expectations and really have an idea for what the coming weeks are going to likely look like, and we can plan for the worst and hope for the best. And I think that's probably a very reasonable approach. But yeah, thank you. One of the things that has really changed a lot in the last 10 years is the amount of packages most people are probably receiving at their homes. It seems like just an evolution of how retail is experienced. Any thoughts or advice as we are receiving packages into our home, or even something as simple as getting the mail out of the mailbox?
Yeah, so that's a big question that comes up a lot. People ask about, do we need to be wiping down our groceries? Should we be wiping down packages? Should we be getting them at all? And that a lot of that came out after a study showed that the coronavirus can live on cardboard for up to 24 hours, and it can live on stainless steel and plastic for up to I think it was 48 to 72 hours. And so that is concerning when you hear that, because that's a lot of the packaging you might see in the mail. But Dr. Fauci, who we get a lot of, he's going to try to give us his opinion too. So Dr. Fauci had gone through some of this, and the consensus is you really don't have to be wiping down your packages at this point. You want to use common sense and wash your hands maybe after handling things. But most of the things I've read and consensus is that you don't need to be certainly not wiping down all your groceries. Treat them as you would normally would. Wash your produce and handle your meat carefully and that sort of thing. And if you want to wipe down your counter after you put all your groceries away and wash your hands, that's probably a good idea. But that's what I would. I don't, so if that's helpful information. But yeah, I think that you don't need to.
Good. Well, we appreciate Luke's help in
yes, he's helping us out. He's saying he's giving his opinion. Sorry.
Yeah, no, that's all right. We're glad to have him participate. Yeah. Another question from a medical perspective: do you think warmer weather that we're experiencing, or even that we're going to be seeing more as we get into the summer months, any thoughts on how that might impact the virus?
I wish I could say that we knew that it was going to kill off the virus, and certainly we know that high heat does kill viral, particles and DNA and RNA and that sort of thing. But there's nothing that's come out that's convincing that says that it is going to kill the virus. And if you look at states in the South that are already fairly warm, like Louisiana, there's already been a lot of outbreaks there. So we don't know for sure, but what I've read is don't hold our breath for that.
Yep, thank you. Okay, last question, and then we'll let you get back to being mom.
I know, you're fine, it's all right.
Okay. I've read a little bit about the Test Nebraska initiative. Can you tell me about that a little bit? And is that something that I should sign up for?
Yeah, so the Test Nebraska initiative was discussed and released by Governor Ricketts a couple of days ago. And Iowa is doing something similar. And it is an initiative to try to pretty massively expand testing up to 3,000 tests a day in our state. And I would assume, and I think he talks about this, the goal is to use that to try to help get people back to work, which is great. So we can kind of try to better risk stratify, who has the virus and who's at risk, and start to slowly open things back up. And so the survey that they want people to take, I took it a couple days ago when it first came out, and it basically just asks some questions to try to figure out who's at risk, and they do take your information so that if you're somebody that they feel needs to be tested, then likely you're going to be on that list. So, based on what we all want, which is reopening of the state and trying to get back to some type of better economy and getting through this, I would encourage people to fill it out. So
awesome. Sounds good. And please look for that update in Deb's email that she sends around on a daily basis. So for anybody that hasn't signed up for that, again, it is deb@gothenburgdelivers.com, and you'll have a link to take that survey. Yeah.
And Nate, real quick, if I can, Dr. Shackleton shared some good information with us. So she did confirm current estimates are close to 25% of COVID patients can be asymptomatic. So that makes wearing masks super important. So.
Yes, awesome. Thank you. Thank you, Dr. Dalrymple, Dr. Shackleton, and the entire medical community. We really feel fortunate to have your support through this time, and also taking the time to empower all of us through education. I know the efforts you guys are making to even have signs all over town, giving best practices, the information you guys are putting out on social media. We really appreciate that. That really is empowering our community to make good choices. So thank you for that. With that, going to transition to Becky Jobman with Gothenburg Health. I have some questions that I think you can help us with. As we go out and about in our community, we see retailers. Is there anything like best practices that you could share with us about mask wearing in public and retailers? And I think by Dr. Shackleton and Dr. Dalrymple's responses, I can about guess what the answer is. But yeah, you mind sharing some of the information with us on that?
Yeah, thanks, Nate. So we are absolutely encouraging all of our retailers in the community that are still open to mask up and get all their employees to wear masks to just further help prevent the spread. And we do want to offer resources. We've tried to connect with as many businesses as we can, but that doesn't mean that we've hit everyone. And if any businesses in the community aren't able to get masks, we will do our best to help you out. We've had a large number of cloth mask donations to our facility, which has been incredible. And we've been able to utilize those to mask our non-medical personnel. So then we can save the medical masks for our clinicians, which is the right practice. But then we can also ensure that all of our administrative employees can wear masks as well to keep everyone healthy and safe. So with that, we've had so many masks donated that we do have some extras that we are intending to equip like recurring patients with, such as like PT patients, so that we don't have to burn through our supply of PPE, because typically we give them a medical grade isolation mask, but those are not an never-ending supply, so we just need to shore up those supplies. So that's our hope, and then those individuals can use those masks out in the community. But we also just want to help people out, so if they can't get their hands on some masks, please reach out to us. We'll send Deb an email address that you can reach out to and get connected with us.
And so if people are needing those cloth masks. Obviously, you're saying the hospital's a resource for them. What about people on the other end of the spectrum? If they're willing to donate or create some of those items, is the hospital a good receptacle for those donations?
Absolutely. We will send that contact information out, and we would love to help take those masks and then get them to the right people that need them, so just better protect our community as a whole.
And I think at our last call, the hospital had issued a challenge to get 500 masks and enough to make sure there was enough for everyone in the hospital.
Yep,
You give
that's
us an
correct.
update?
Yeah, I'm just gonna give, like, I don't know the exact number, but I think we're like at 485 or something like that. So yeah, we kind of asked for an overabundance so that we could have everyone here covered with a mask and give them 2 so they could swap them out and keep them washed, and then potentially even help them cover their family members when they're out and about in the community. So that was incredible, and we still have people reaching out to us to want to donate masks. So we really appreciate the support.
Great, appreciate it. Becky, are you aware of a Department of Health and Human Services resource that talks about all the different resources that are available for patient needs? Is that a website or anything that you're familiar with?
Yeah, I actually just kind of learned about it earlier this week, but it's kind of a unique resource page to show just the collaboration between everyone from the governor down to the public health departments to each individual healthcare facility. And I know Nebraska's been working really hard to work very collaboratively so that we know where resources are and where needs are. So I'm sure you heard in the news that some of those patients from Callaway were taken to Great Plains Health in North Platte. And I think that's just a great example of recognizing that there were beds available that could effectively treat the patients. So it's just another kind of level of transparency and showing what the state's doing and how we're working together to consolidate resources and take care of each other.
Great, perfect. Well, thank you for all your work on this, Becky. Really appreciate you sharing those insights with us. We're going to jump to Dr. Rhodes with Gothenburg Public Schools. And Dr. Rhodes was actually listed later in the agenda, but because of other meetings and time conflicts, we're going to have him share some thoughts with us. Dr. Rhodes, one question that continues to come front of mind for many parents, and in full disclosure, I do have a senior this year. Are we going to have a graduation? Can you answer that burning question?
Yeah, that has kind of been the million-dollar question here at Gothenburg Public Schools. And of course, we have planned all along that we were going to have some sort of a commitments exercise for the class of 2020. We did formalize a date and time as of today, and we did communicate that out to our seniors via email earlier. So commencement exercises here at Gothenburg Public Schools are going to take place on Saturday, August 1st at 7 p.m. And the reason we chose the time that we did is the type of exercises will certainly be commensurate with the guidance and the direction that we get from the state of Nebraska and with the local health department. So we're going to plan multiple types of commencement exercises based on what we're hearing from the health department. So we thought if we went a little bit later in the evening, we have the possibility maybe to be outside, utilize the football field. We hope that it can be as traditional as possible, but we also are realists and understand that we need to have maybe a plan B or C. But yes, August 1st at 7 p.m.
Great. And kind of begs the question, and it was talked about a little bit last week, but if we're talking about some questions around an August 1st start date, typically we go back to school and start fall activities mid-August, early August. So you could kind of infer from that, yeah, we may be looking at an unusual fall start potentially.
Yeah, again, we're having discussions not only locally but at the state level. Dr. Bloomstead, Commissioner of Education, is encouraging school districts to come up with multiple plans on what that start of the fall semester might look like. So as an administrative team, we actually spent some time this morning talking possibly what summer school would look like, and then the start of the fall semester as well. So anywhere from traditional, we open up our doors, we're in session in a physical setting, all the way to remote learning like we're currently doing with a hybrid plan in between. So we will not be ill prepared when it comes time to start that fall semester. And again, that will all be based on guidance that we receive from the state and from the health department.
Great. Well, certainly appreciate the school's commitment to changing and adapting with best practices, always keeping students' best interests in mind. So very job well done by the school. Appreciate all the hard work with that. So thank you, Dr. Rhodes.
Thanks.
Yep. Gonna transition now back to Mick with continued updates from the hospital. Mick, have had a question that since Two Rivers can't specifically identify the active cases by community, that's being done by county, is the hospital able to share information on a community specific basis?
Unfortunately, the answer to that is no. We really follow the health department's lead on that, and there's just a lot of reasons, to protect those patients, and so no, we cannot do that.
Yep. Yeah, appreciate that. Okay, next question. Can you help me understand the difference between an elective procedure and a routine procedure? And what are we doing? What are we not doing? What's appropriate?
I think elective and routine are probably pretty close to the same thing. They're not emergent. So emergent things are like we can do emergency surgeries, and emergency room is still open. We're not really doing elective procedures. We are doing some routine wellness visits, and a lot of those are happening via telehealth and things like that. But routine and elective kind of fall in the same category of we're not doing as much of that, and there's more focus on the emergent kinds of cases.
Great, appreciate the update. And then have had varying questions on hospital preparedness. I know you spoke to that last week, and questions ranging from what do we do if we do find ourselves immersed in COVID cases? What's that game plan look like? I know you did share some information about that and some of our capacity opportunities. Yeah, you mind sharing a little bit of insight on that, on those game plans?
Sure. So we sort of have two plans, and the first plan was really looking at our own internal resources and what we could do to ramp up our number of beds. So we reached out right away to Hilltop to see if they had any open beds, and Scott was pretty forthcoming and said that he thought that they would have 20 beds that we would be able to use. So then we just kind of had to come up with a place where we would put those. So that would raise our capacity from 12 beds to 32 beds. Then we have a plan in place to be able to divide our patient rooms into from private rooms into semi-private rooms for all of them. And then we've got some space in surgery where we would put some. And then our PACU, our CRNAs have been working to really make that into an ICU type of situation. We have the capacity using our anesthesia units to have 7 patients on a ventilator. We don't want to have to do that. So that's sort of our plan. Right now it's our plan B, but it was the first plan we came up with. Right now our go-to plan is kind of an exchange with a couple of the tertiary care hospitals as they ramp up and have ICUs and things like that. And they can take our COVID patients and we'd be willing to take their non-COVID patients. So that hasn't happened. None of those hospitals have gotten to capacity yet, but we're still hoping that would be the path that we would take, keeping the COVID patients really, even by facility, separate from the non-COVID patients. But we do have a plan in place that if that doesn't work out, that we can take care of in beds 32 patients and on ventilators up to 7. So
awesome, great. really appreciate all the work that has gone into making those plans happen. And then I'm just proud of the collaboration between the different facilities, working with other entities to make things happen. That's just one example of several cooperative efforts that the hospital's engaged in to try to get the best outcomes for the community. Yep, thank you, Mick. Next, have some questions for Karen Gutherlist. Karen is a licensed independent mental health care practitioner. She is also the program therapist for the somewhat new Senior Life Solutions program. So Karen, if you could share with us just a little bit about the Senior Life Solutions program that is happening right here in Gothenburg now.
Yes, we've been active for almost a year, starting in May, and anybody 65 and older that is struggling with their mental health issues like anxiety, depression, or any other diagnosis who needs support. We have group 3 times a week, Monday, Wednesday, and Friday, and individual sessions every other week. And we work on small term goals and long-term goals as well. And we have a psychiatrist that flies in here, Dr. Gillette, that does the evaluations and the medication checkups once a month or twice a month, depending on the patient's needs.
Great, thank you. Okay, into some questions for Karen. I think most people could probably relate to this. I find myself from time to time maybe having more negative thoughts than usual. Any tips on what I can do to work through that?
Well, it probably depends on your personality, what helps you, but meditations or listening to mindfulness meditations is a good tool you can tap into on YouTube, or looking up on Google different meditations as well to read. Talking to a counselor, some friends, or a pastor to encourage you to think on truths of who you are. A lot of times when we go through trials, we kind of start identifying ourselves as the problem occurring to us, not on who we really are. So focusing on what is happening to you rather than on what is true about you will quickly lead you to despair and depression. Truth can be your spiritual beliefs or values that you have declared for your life, and journaling these thoughts out and reviewing them, if they are helpful or not, can also help a person to reframe their mind on how they're communicating and talking to themselves.
Yeah, appreciate it. Yeah, good pointers, and certainly stuff I can implement to help me. So thank you. Right now, it seems like social media and the news in general, when I go out and try to interact with some of those sources, I'm almost overwhelmed by the news that's out there. And realistically, not a lot of it's positive. You know, there's a lot of negative news out there. Any thoughts on managing all that information and how I can work my way through that?
Yes. Recognize that the media likes to catastrophicize things more than what's realistic. But our tolerance level is also different for each person. So I would suggest if the individual finds the information too overwhelming and their depression and anxiety symptoms are increasing, that it's just best for them to shut off the TV and find other things to do, their hobbies or interests, or something more enjoyable.
Yeah, absolutely. And even as an example of that, just today I learned about the percent of people that have probably had COVID that were asymptomatic, didn't really struggle with it. And to me, that's good news, but probably a statistic that I hadn't seen in the public domain a whole lot, and very actionable in a good way to encourage us to make good choices and to wear those masks. So yeah, thank you for giving us some perspective there. There are many people today working remotely, and there's good and bad that comes with working remotely. Sometimes the good is having the family close by, and sometimes that can create a challenge. And we saw an example of Dr. Dalrymple managing that very gracefully just this afternoon. But do you have any pointers for us as people find themselves in that unique work environment?
Sure. And again, this is different as well for people. But if you can reach out to family or close friends that are mindfully practicing social distancing to assist you, that's one idea. Another option would be to manage your schedule enough that your children are busy with their own projects, playing, and if they're a school-age child, structuring their day for their homework or their assignments from school. The more structure a kid has, the better they are, and also rewarding them for following the rules or your directives. And then that teaches them to respect your boundaries.
Great.
Yeah.
All right. Thank you. Thank you for those pointers. Earlier in the questions, I talked a little bit about myself and some struggles I might be feeling myself. But what if I start to see those tendencies exhibited by other people, say a spouse or a loved one? If I start to see symptoms of depression or anxiety, what would be some of those symptoms I'd be on the lookout for, and how could I help them?
Well, depression can be someone who is not motivated, feeling really down, can't get out of bed, has lost interest in things they used to normally do, are talking very depressing thoughts. And if they're suicidal, you definitely want to get them to the hospital in the emergency room, or call 911 for them, or share the hotline number to them as well. If you already know they have a pre-existing condition, they can also call their primary care physician or psychiatrist to increase their medications at this time. Or if they are newly getting depressed, having them work on some mindfulness as well to reframe their thoughts.
Great. Appreciate it. Our community has a lot of elderly that are probably today more isolated than what they ever have been. And we all probably know some of the elderly people that are dealing with physical distance right now. Any ideas on how to support those people?
Well, there are a lot of young people in this community as well that can volunteer to bring them their groceries, run errands for them, to visit with them on Zoom or other telehealth platforms. Calling them on a regular basis is also encouraging for them to feel connected and not so lonely. If you find that individuals not answering their phone, then you can also have the police do a welfare check on them. The hospital has our Senior Life Solutions program again, and we're here to support them. And if we get a referral, it doesn't have to be from a physician, it can be from anybody in the community. We can have an evaluation on them to see if they're a good fit for the program.
Great. Well, thank you, Karen. I really appreciate you taking time to participate with us today and share some good pointers and tips for all of us. So thank you. Next, we have some questions for Nicole Hetz. Nicole is our early childhood coordinator here in Gothenburg. So Nicole, if you want to tell us just a little bit about the Early Childhood Coalition.
Sure. We work with the providers in the community to support the work that they're doing, as well as advocating for the importance of early childhood and working to encourage parents to take advantage of the opportunities, the early childhood care and education opportunities that we have. Our mission is to address community-wide challenges impacting children and families, and so that goes beyond just the early childhood care setting, but the total childhood experience.
Yep, good. Well, thank you for your work on such an important topic. If somebody in the community is having a tough time with their own personal financial situation, does the Early Childhood Coalition have some resources available to them?
We do, along with our mission to address all of the challenges that go along with children and families. This is a big one right now, the family financial situation. And so we are really pleased to have partnered with Flatwater Bank to offer a free webinar next Tuesday night, April 28th at 6 p.m. It's entitled Navigating Financial Stress During a Pandemic, and it's designed for anyone who's just maybe overwhelmed with trying to understand the stimulus payments and unemployment, balancing bills, and maybe some medical expenses, whatever it is. We are just going to walk through some of that, do some basic budgeting tools and tips, and just try to maybe alleviate some of the stress around the financial situation right now. All of the login information for that is on the GECLC website, which is geclc.org. And so there's more information about that there. We've also created a list of additional resources and services. So contact information for family services, for food services, for emergency services, mental health, DHHS, just a list of additional resources that families can contact for specific help or with questions. That is also available on our website. And finally, we are pleased to announce that Nebraska Children and Families Foundation is working with Dawson County Communities to create a community-wide well-being initiative. And part of this initiative will be to distribute resources to families who need them. So short-term plans are to begin meeting the immediate needs of families and then working into an ongoing collaboration and care structure. Our first meeting is next week. So as that begins to take shape and unfold, we'll certainly keep the community informed of that as well.
Great. Well, thank you for all your work on that. It's interesting to me, as a community, we have a workforce that is very skilled in many different things. But as of right now, as we're going through this major change, we're asking people to deal with paperwork that's not their skill set. That's not their strength. That's not what they're good at. And so some of those resources and people like Nicole and people like the financial professionals in the community, please utilize those resources that managing their way through those forms and those documents and getting through the paperwork is their skill set. So if you know of someone who's going through a tough time, please encourage them to reach out to help because there are resources available. And we're lucky to have people within our community that do have those strong paperwork skill sets that can help people going through a tough time. So thank you. What about local child care providers right now? How can we be supporting our local child care industry?
Yeah, so we have some child care providers who are still caring for children. Those would be our in-homes. And then we do have some who are, because of the medical situation, not. We are continuing to keep in contact with all of the local providers. We are finding out what they need to remain open, if there are supplies or resources needed, or what those who are not open now will need in order to reopen. So we are staying in contact with the providers, also sharing available resources as state or federal resources become available, making sure that our providers are aware of these. And I think the pandemic has shown us just how important early childhood care and education is to the infrastructure of the community. And so as we continue to work to support the current providers, we're also working to ensure reliable childcare will be available for all children into the future. Every household in town, actually today, is receiving a postcard that's sharing more information about our new community partner program. And so this is a chance for anybody in the community to help support the efforts that are supporting the childcare providers that are doing such an important job for our community.
Great. Thank you, Nicole. And for anyone who, whoops, I do have a copy of the postcard here that was.
I've got mine.
Okay. Yeah, you're not using the virtual background. Yeah, there we go. And it did come in the mail, and what a great resource. So thank you, Nicole, for all your efforts on behalf of the community and on behalf of such an important demographic, the early childhood within our community. So thank you. Next, we're going to direct some questions to Sean Kashke with UNL Extension. So Sean, thanks for taking time to join us today. We've sent out in our daily updates a survey, and that survey has ties back to the university. Can you tell us a little bit about that survey that people have probably seen in their inbox?
Yes, thanks for your question, Nate. Yes, there are several state and federal assistance programs to support key community business and services, like Nicole mentioned, and how navigating that's kind of complicated. Will is going to post, I think, a few of our university resources in the chat sidebar that many businesses and families have found useful over the recent time. Please contact your local office for any specific questions about these resources. Nate, while you, Dev, and other state and local officials have done a nice job providing an overview of the federal CARES Act benefits for both employers, employees, the state of Nebraska, but the university and other partners are trying to understand the best way to support our business, nonprofit, and nonprofit community during the crisis. So regarding this C19 or COVID-19 survey, any Gothenburg business responses will help the university and other state partners understand what the economic impact of the virus has been on the local revenue workforce, so that any potential resources and funding can be fairly distributed across the state, especially to specific industries of need. So if you are a business owner or a nonprofit manager, please take a few minutes to make your voice heard by submitting the survey. I think Nate's gonna put it there. The website is bit.ly/Nebraska BIZ Biz Survey 2020. If you just Google search Nebraska Business Survey 2020, that website, it only takes about 20 minutes. And if you have a Twitter account, you can just put in #Nebraska and it should show up pretty quickly. I'd also like to mention at the federal level, regarding the census, I've learned that Dawson County is at 52% response rate for the U.S. federal census, ranking it at 45th amongst Nebraska's 93 counties. So we're right in the middle. While that's a little bit below the statewide average of 58%, the city of Gothenburg is much higher at 66% compared to 46% in Lexington, 61% in Cozad. And this is according to my friend David Draws. He's a UNO statistical researcher at UNO who has direct insider access to the census results. And he said to give the community of Gothenburg kudos for your 66%, but last census, 2010, the community had a 77% response rate, which just is great. He said, so keep going, you're almost there. So keep getting that census. And the reason why the census is so important, like just remind you guys, they've done analysis that completing the census is important because $20,000 a person flows back to local areas over a decade from the way the federal funding formulas work based on census count. So this means that you matter, you count, and this is true everywhere, but especially in our rural communities that have been experiencing some depopulation. Also remember that the census is safe, confidential, and easy. You can't be identified by ICE immigration or law enforcement, and they've got it narrowed down to 10 questions, so super easy to complete.
Great. And Sean, I know I've received a few communications and even some email correspondence about the census, and I think some of them have even come to different people within our household. But if I understand the census process correctly, it's one per household, and all the questions are based on a household, and there's a special code that's tied to your address. Is that correct?
That's right. So either the code is, whether let's say you or a spouse may have gotten, your wife, Nate, the same code should be if they've done it right, should be for your household. So it's one per household. It's unique to that address, whether it's you or your wife or somebody else in that household. So it's okay. You're not going to get it wrong.
Perfect. And so just to recap, there's two different surveys that we need to be on the lookout for. One of them closes tomorrow, if I understand correctly. The University of Nebraska survey closes tomorrow. Is that correct?
Yes, and that's that economic impact survey. And so the state's working on more programs to support. The CARES Act's not going to be enough. And so the state is working on their own resources to support them. And to make sure that those resources are equitably distributed, please go and fill out that, it's under number 2 that Nate put there in the chat, the CARES Act benefits. There's the state economic impact survey that we need as many businesses to complete as possible, especially in our rural areas, to make sure that those resources are fairly distributed.
Great. Well, thank you, Sean, and thank you for raising some awareness of what is very important work that Gothenburg needs to do, not only to help get information about our current situation, but to give us the tools to make a positive impact in the future. So thank you. And those will be in the update, again, encouraging people to take those surveys. So thank you. With that, we're going to transition to Mayor Hudson. Mayor Hudson, thank you for joining us again today. I have some questions for you. Start out with an easy one. Can I check out a book at the library?
Yes, the library is not open for to come into, but you can call the library and they will find a book and leave it at the back or the west door for you to pick up. They also encourage you to go on their website and go through their catalog and reserve it. It usually takes them just a few minutes. So if you decide at 3 o'clock you want a book, you can go get it by 3:30. So we are having discussion on maybe opening it a little more on a more of an appointment basis, but that has not been finalized yet.
Great, awesome. And at a county level, last week we talked a little bit about the election and the potential to get early ballots through the mail. You have any information or updates on that?
I really don't have any updates. It is our honor to be able to vote, and our votes do count. And so I know they're struggling to find personnel to man these, but with our current situation, you have until I believe May 1st to get with the county, either send in the form that came, contact the clerk's office, get an absentee and send it in. That way you know your vote will count. And it is important to vote, so please make an effort to. If you can't, mail it in, that is okay too, but the more we can do by mail in this time around, the better off we'll be.
Great, thank you. And any thoughts on wanting to be number one in the county when it comes to survey results? And we think Gothenburg can be right at the very top, don't you?
Well, absolutely. When we talked earlier, we talked about at that point it was the Dawson County percentage, and it was 50-some%. And I said Gothenburg's better than 50-some%. And now that Sean has said we're at 66%, we're still better than that. And we need to fill out these surveys and or the census. Even if we're not talking the virus that's going around now, these census are important to a community. They really affect some of the programs that we can participate in. So I've done my census online. It's not too challenging. I guess if someone really has questions, they need to call. I guess you can call me and we can walk you through, but you need to do your census. It's important for the community in the long term.
Absolutely. And if I understood Sean correctly, our historical performance was a 77 completion rate. I'd like to think that Gothenburg is better today than we were 10 years ago.
I'm sure we are. And then he talked about some surveys. I have done those surveys. They are really a piece of cake to get through. There's just a few questions. And I think it's like Sean said, we need to have a good representation from rural Nebraska. We sometimes feel that we don't get the attention that Omaha Lincoln gets. So whether you're a one-man show in a business or you have, 3 or 30 or 100 employees, you need to fill this out so they know what the needs are. We can't let them forget that we're out here in rural Nebraska and we need help too.
And this applies to nonprofits as well.
Yeah, and they're
nonprofits as well. Anybody that's an employer.
Ask a lot of real private information. Is just general information, and it needs to be filled out, and it can't take more. I think Mick said he did his in 10 minutes. I know I didn't spend any more than 10 minutes on it. So
great. Please take the time to do that. And then Mayor Hudson, I think you've had the best comment that rebutes social distancing. And social distancing is a phrase that most of us didn't know 3 months ago. It's front of mind for all of us today. And I think you've got a better way to say that.
Well, we've had that pushed at us, and we're almost tired of hearing it, but it isn't social distancing, it's physical distancing. We can still be social. There's so many opportunities, there's the Zoom, there's Google apps that we can get on. Now's a good time to gather your family. I have family that's spread out. We got together and all of us could talk at the same time. Maybe you have an old high school group that you'd like to have conversations, but everybody's in the same situation. So you need to reach out and, maybe you have old employer or work people that you haven't seen in a long time. We just need to reach out through the options we have, and not a text, but some FaceTime exposure and talk to these people, because everybody's in the same boat. Everybody wants some social life. So yes, we are not social distancing. We are physically distancing right now.
Very well said. Thank you, Mayor Hudson. Great.
Thanks.
we have Julie with the YMCA with us today. And Julie, thanks for taking some time to be with us. Have some questions about just generally what's happening at the Y. What's going on with the YMCA these days?
Well, so the YMCA is now providing childcare for frontline hospital workers. It is something that we had to really work at because it was not, because Antonia was not, who runs our childcare, was not able to be here for 21 days. So she is now back, and things are kind of running a little bit. We're in a routine. So, but we've been busy. All the full-time staff here has been working 10 to 12-hour days, 5 days a week, making sure that the little ones are all taken care of, and it's been going really well.
Awesome. Have had some questions about summer programming, the baseball. I think maybe we talked about that a little bit more with some of Dr. Dalrymple's comments, but any thoughts as it relates to programming that's available?
Well, yeah, we're trying. We are ready to do baseball come June if we can. We are moving forward as though we are going to be able to do baseball, and just had a meeting about the outdoor pool and what that's going to look like. So we're hoping that we can do some type of summer programming. How that's going to look, I don't know, but we are ready to go. We'll be ready to go if we get the go-ahead. So
Great. Well, thank you for all the work and preparing for the best and hoping for the best. And
yeah.
I know you guys will be there to do anything you can to promote the youth and promote wellness within our community if we're able to. So thank you. Appreciate it. We're getting close on time. Pastor Jamie, thank you for taking time to be with us today. A few questions for you. Can you give us an update about the food pantry? How's the food pantry functioning?
The food pantry at the moment is doing quite well. We are fairly well stocked. However, we have seen a lot more people stopping by. Our big concern with the food pantry is if the schools do discontinue feeding the students on May 15th, which is one of the things that we have heard, then we have some concern about how we as a community are going to continue to care for feeding our children. And that's something that is just beginning to be talked about. We had also heard that the school might be, they're trying to extend that as a possibility, both for regular lunch feeding as well as the backpack program. So we're kind of keeping our eyes open for that. Just a reminder that that is housed at the American Lutheran Church. And if people want to buy things, we're certainly happy to receive those. It's best to call ahead because they're not open all of the time. The kinds of things that we would take to continue to stock the pantry are spaghetti, mac and cheese, particularly things that our kids are happy to eat. Soup, they're kind of specific. They prefer chicken noodle, vegetable, tomato soup, canned fruit, tuna helper, those kinds of things. Crackers, cookies, they really like that. So that's kind of where we are with our food pantry. If people want to donate items to the school, or items if they want to donate cash, there we go. We do give out vouchers to Peterson's Grocery for milk and bread, eggs, ground beef, those kinds of things, so that people have options of getting some of those things that are fresh, and that's how we handle that.
Great. Well, thank you. Volunteer opportunities, are you aware of, it seems like there's a lot of people willing to volunteer for different things right now. Do you have ideas of how people could help with some volunteer hours?
Well, Meals on Wheels is the one that needs help, and that's coordinated through the senior center. But I'd recommend that. But keep your ears open, because if we need to start feeding more people because of an ending of the school lunch program, then we might very well need to call on volunteers to help coordinate and pack food bags for that. So keep your ears open. At the moment, we're doing fine, but in the future, I think we might very well need more volunteers.
Great. Thank you. Really appreciate your update. So with that, we are at 5 o'clock, but do want to ask Senator Williams to wrap it up for us. So Senator Williams, any thoughts from the state level?
Well, thanks, Nate. Again, I always enjoy this opportunity and appreciate everybody in Gothenburg and what all they're doing. A couple of things that are just some quick takeaways. Many of the individuals in our community and many of the businesses are receiving their stimulus payments at this point in time, so know that that money is there. Those are the ones that are directly going into bank accounts. The checks will be issued in the next week or two. Also, a couple of takeaways from the governor's press conference today. Because of the high increase in testing positive in Dawson County, it is likely that the directed health measures could be extended actually for Dawson County. I think that's okay, and we'll just abide by that. Also, the governor does not see any chance that the facility in Lexington will be closed at any point in time. I think that is really good news. Tyson's is stepping up and providing their employees the protections that are needed, and also recognizing that how important the food chain is. So that's being done. Also, it may not affect many of us here, but in the county it certainly does. The communication with the governor's daily press conference is now going to also be conducted in Spanish. They're going to broadcast that later in the day, so those people can certainly have the opportunity to hear those things. Also, I personally had the opportunity to communicate with the Lexington Hospital, very concerned about the increased numbers there. They have experienced an increase in emergency room visits. They have transferred a few patients out, but they assure me that they have great employees there. They have beds available, and they have ventilators available if necessary, and their employees are all ready to go. So no panic with that. I wanted to take just a minute and talk about the fact that starting with the National Guard being in Lexington last week on Friday and Saturday, and then again on Monday and Tuesday of this week, my office started getting a number of calls coming in that always started with the words, "I've heard that something about Tyson's," or "I've heard something about Lexington," or whatever. And I just want to caution all of us of how damaging rumors can be. And we started as an office chasing down what were clearly rumors at the beginning of this week, and everything are rumors. And I think it's up to each one of us to recognize that and to not be part of that rumor chain. When somebody says something that you just know is not true, I will tell you, Tyson's is stepping up and doing everything they can to protect their employees. Are there situations that are difficult in Lexington with Tyson's and the surrounding area? Absolutely. And it's important that we all accept those responsibilities, as we talked last week. Also this week, one of my staff members put together a list of all the special things that have happened because of COVID virus. And a couple of those that hit me was, one was homeschooling is going well. 2 students suspended for fighting and 1 teacher fired for drinking on the job. And then my personal favorite is, my body has absorbed so much soap and disinfectant lately that when I pee, it cleans the toilet. So I think even though we have serious issues that we are all dealing with, there's a level of humor that we can use to adjust our thinking and help everybody else out and pay so close attention to those mental health issues. So thanks everyone. Gothenburg's doing great. I'm very proud to be a Swede.
Thank you, Matt. And thank you to everybody, not only who has taken time to participate by being a presenter today, but to all the people that logged in and took the time to educate and empower themselves on these very, very important issues. If I could ask one thing for the people that were participating in a non-presenter fashion, could you please relay some of this information on to other members of the community, to your other family members, to members of your social circles, and to your coworkers. The more information, the more education we can get out in our community, the more gracefully we're going to get through this challenging time. Thank you, everyone. Good night.